starting. Yep. Can I have a...
I love how you
Okay. Are we all
Ready to rock and roll.
all feeling fed and watered, invigorated, ready to get onto CPR? Beautiful. Okay. Cardiopulmonary resuscitation, CPR. So, in this session, we are going to learn about CPR on adults, and I also have 2 baby dummies as well. So we're going to do a bit of practice on those for those who want to. Do we need to do the whole introduction for this session as well?
yeah, I would.
You're going to talk about what you did in the last session.
You should do, yeah.
Okay, so in our previous session, we discussed how the respiratory and circulatory system work together. So you'll see the importance of that when we start doing CPR on the dummies, but when you were doing on a person, you are being that external heart pumping for that person, just to get that blood flowing around the body. Okay, so for CPR, I'm just going to show you this quick little video. It's not working. Oh, here we go. This is my mate Vinny, and he shows you how to do CPR. Now this is a British one, so just remember in Australia we ring 000, not 999. All right, so here comes young Vinny.
My name is Vinny Jones, and I'm going to teach you a lesson you'll never forget. There are times in life when being tough comes in handy. Say some geezer collapses in front of you. What do? We need a volunteer that ain't breathing. This one I made earlier. First thing you do is you check him over. If he ain't responsive or he ain't breathing, or he's making noises like this, then his heart stopped working, he's having a cardiac arrest. Look lively. First call 999, then you do hands-only CPR, and no kissing. You only kiss your missus on the lips. Watch, lock your fingers together, knuckles up, then push down, right on the sovereign. Push down 5 or 6 centimetres. That's about 2 inches in old money. Push hard and fast, about 2 times a second. Like to the beat of staying alive. Worried you'll hurt him? Better a cracked rib than him kicking the bucket. Keep this up till the ambulance arrives. So don't forget, check him over. Call 999, push hard and fast to staying alive. It works. Hands only CPR. It ain't as hard as it looks. If you want to come in handy in an emergency, why not sign up for
Okay,
one of our heart start courses?
thanks Vinny. That's one of the, just a light-hearted way of looking at CPR. Still same process. We ring here, we ring 000, we go down 1/3 of the chest, where he was talking in inches, which we wouldn't use. Okay, so we'll go through our, if you've done all your online component, you would have known about the DRS ABCD, and the first thing is the D being for danger, and that is danger to ourselves, to the casualty, and to bystanders. So we need to make sure everybody is kept safe. So if Joe here is laying in the middle of the road, he's been hit by a car, I mean, we can't just go rushing over because we may get cleaned up next. So we just need to make sure, have someone stop some traffic, there'll be plenty of bystanders around, one of them can help you out. Okay, so we need to make sure that if he's laying on the hot road and it's a 40-degree day, that we try and move him somewhere into the shade. Okay, so we're going to also check for a response. So this is the R out of your DRS ABCD. So as a response, we aren't going to wait until we get to the patient. we're gonna start calling them from whatever meters, however many meters away we are. So, hello, can you hear me? Hello? And if they sit up and go, hi, well, we know they've already got the airway and they're breathing and they're okay. If we come across a accident scene where you've got, say it's a car accident, you've got someone over there who's screaming, well, we're not gonna worry about him yet. We're gonna prioritise the quiet ones because death is silent. Those that are yelling and screaming, they've got an airway and are breathing. So we've ticked off those two as well. So, the other, our Hippocratic Oath, prevent, do no further harm. So we don't want to do anything that is going to harm our patient any further than they already are, unless of course danger overrides absolutely everything. We need to make sure we take care of airway and breathing. So we, that would be our first thing that we're doing to make sure that they, the airway is clear and that they are breathing. There's no point in doing CPR on a person if they've lost a leg, because as you're pumping, or you're just pumping blood out, if you've got catastrophic bleeding, you need to get that under control first. Any cuts and scrapes can wait. Protection, so we need to ensure that our person is safe. We don't want all these people just standing around videoing what is going on. It's kind of make use of those people, get them to do something for you. We also, if the person is unconscious, it's been proven time and again that they can still hear everything that is going on around you. So you want to speak kindly, you want to be reassuring them, you want to monitor them, you never ever leave their side. Once you are with that person, you stay with them until the paramedics come. So if there's more than one person at an accident scene, like I said, you treat the quiet ones first because they're the ones that probably are not breathing. The ones that are screaming and yelling, they can wait. You can send a bystander over there to try and assess what's going on and they can look after it. Okay, so for your own behaviour, you need to remain calm. There's no good rushing over and panicking on, oh my God, what am I going to do? What am I going to do? Check your pulse first. Make sure that you're nice and calm. Take a few seconds to absolutely look around visually and see that the scene is safe. Communicate appropriately, be respectful, so no swearing, no yelling, no screaming. And only move the casualty if it is too dangerous to leave them where they are. So, as I said before, if they're laying on a hot road, it's a 40-degree day, you do want to move them. If they're in a car and the car's teetering on the edge of a cliff, once again, assess the danger. If you can get them out of that car quickly, do it. If there's a fire, just try and remove them from that as well. So that's also protecting them from the elements. And always only provide treatment within your scope of practice. You've been trained to do CPR, you're not trained to do a tracheostomy. So you're not going to be sticking pens in necks and things like that. As if you remain within your scope of practice, doing your what you've been trained to do, you'll be covered under the Good Samaritan Act. So you can't be sued. If you go outside of that scope and try and do things that you are not trained to do, you can and you probably will be sued and you will have not a leg to stand on. So you stay within what you know. Okay, so this shows the DRS action plan. So danger, ensure there's nothing that can cause any more harm before you proceed. Response, you need to obtain a response if you can. If not, the best way to get a response from someone that is unconscious, if you get your thumb and your hand and at the base of your neck, you squeeze the trapeze. So if you all do that, so just in front of your collarbone, but at the base of your neck, you give that a little squeeze and you can feel that sharp pain. That hurts. Yeah, so if they're going to go like this or you know, they're gonna
Yeah.
try and get away from the pain.
Yeah.
If they're not doing that, then you definitely have no response.
Yeah.
Okay, so then we move on to our S, send for help. There's nothing worse than doing 40 minutes of CPR to find no one's rung trap below. You need someone to send for help. Even if 3 people have rung the ambulance, that's better than no one's rung the ambulance. Okay, so with danger, stay calm, coordinate the scene. So make sure you have got control of everything that's going on around you. Move the people back if you have to. If someone's filming, ask them to be a bit more respectful. We don't need that. And if you have in your car, I mean, we always carry a decent first aid kit. So we have gloves and masks. And so just, yeah, whatever you need to put on, you put on. Continually monitor the patient. If you've done CPR and you've got them in the recovery position, all of a sudden they could stop breathing again. So you need to roll them on their back again and restart your CPR. Okay, so with the response, you conduct the initial visual survey to see what's happening. If they're not responding, but they are breathing, you put them into the safe side position. Okay, if they're not responding and not breathing, then we immediately start CPR. Okay. Chain of survival. So the earlier access to an ambulance, the better off your patient is going to be. Sending for help is just so important that we just cannot forget it. Early CPR. For every minute that a person is not breathing, reduces their life expectancy by 10%. So really, you've got 10 minutes before they're gone. So you want to get CPR onto them as quick as you possibly can. Also, early defibrillation. So you want to get someone to go and grab your defib as quick as possible. A lot of work bands now actually have a defibrillator and first aid kits in their vans, and they will have a sign on the side of the van saying defibrillator inside. You can ask them, look, and get your defibrillator, bring it over, we'll need that. And of course, getting them to advanced care as quick as you possibly can.
Defibrillator,
So
right.
getting them into hospital. Oh, here's what we prepared earlier. A real defibrillator, right here. Nice. Okay. So, then we move on to, so we've done our DRS, danger response, send for help. Now we move on to AB, airway and breathing. So, our airway is our mouth, our windpipe. So, so we always make sure that the casualty is comfortable. As I said, we get them off the hot road. We always check, we do a visual check to see if there's anything in their mouth. It could be broken teeth, it could be vomit, it could be saliva. They may have been chewing on gum, so it could be anything like that. And we need to clear that airway out. The old thing used to be, oh, you know, just put your finger in there and feel. You never ever do that, because if they suddenly come to, they'll bite down and you'll be going to hospital with that patient. So we don't want to be doing that.
With a missing finger.
That's it, exactly. So we always do the head tilt, so that's with the pistol grip, which is like that on the chin, the other one on the head, and we tilt the head back gently. So if we don't do that, if you put your chin to your chest and try and take a deep breath, all right, that feels a bit restrictive. You put your head back and you can feel you are getting so much more air than what you would if your head wasn't tilted back. So when we check for breathing, we check for, we look, feel, listen. So we are looking at the rise and fall of the chest. We are feeling any air on our cheek, and we're listening to hear if there's any air coming in and out of their mouth or nose. Compression, CPR and defibrillation. So 30 compressions to 2 rescue breaths. Now, the Australian Resuscitation Council guidelines state they would prefer you to do rescue breaths. If you don't want to do rescue breaths, or if there's too much trauma to the mouth, face, and you think, well, it's going to be impossible, that's still okay, because when you do your compressions, it creates a overpressure in the lungs, and that means they are getting some oxygen as you're doing compressions. But they would prefer you to do the 2 rescue breaths. So, with an adult, we do the 2-handed procedure, where we interlock one hand over the other and pump that way. We keep our arms locked in and we roll from the hips. It's much more efficient. If you're trying to do it like this, you're gonna peter out in 2 minutes, and you won't be able to help that person at all. So you attach the defibrillator as soon as it is by your side. You can have somebody else attach that for you while you're still doing compressions. You don't, if you're on your own, you're just gonna have to do it all yourself. But if there's someone just standing there like, hey, come on, help me, and just get these pads on this person's chest, please. You follow the defibrillators. As soon as you turn them on, they give you all the instructions. You'll find that very soon. Alrighty, so the defibrillator treatment plan. So once you've got the pads on the chest and you turn it on, it will tell you whether it needs to give a shock or no shock advised. So it reads a heartbeat. Once you've got those pads on, everybody needs to have their hands off the body, because if you're touching the person, it will pick up your pulse, and then it won't give the person a shock, and if they do need it, they're not going to get it. The other thing is, if it does say shock advised, you're going to get jolted as well, and we don't need them. Once again, you're in the ambulance with the patient going to the hospital. Okay, so the machine will prompt you to do everything that is needed. Okay. All right. Infant CPR. So with an infant, there's no difference. We're still going to do 30 compressions, 2 rescue breaths. The only difference is we're going to cover their mouth and nose with our mouth. And it's 2 fingers, correct. We only use, for a baby from 0 to 1 year of age, it's a 2 fingers that we use on the chest. For a child 1 to 8, depending on the size of that child, we do 1 hand and it's a palm. Yeah. It's still 1/3 of the chest is how deep you go with those compressions. And everything is exactly the same with the defibrillator. The pads will go, one will go on the front and one will go on the back. And that's quite alright. If the child's got a slightly bigger chest, you can put them as they're meant to be on the upper right and lower left, but those pads cannot touch or they'll laugh themselves out. Okay. So, recovery position. As you can see, it's 1 arm across, 1 knee up, and they will automatically roll over. We do that in case there's if they're going to be sick, or they just cannot hurt themselves anymore if they're laying on this side. They can't swallow their own vomit or anything like that. So you need to stay with that patient at all times. Okay, so let's practice. I will, if everybody wants to two to a dummy, bring your faces with you. Okay, there are wipes there. If you would like to give your face another clean, you can do. Okay. So 2 per body, 2 people per body.
Honey, just get around the half circle first.
Okay, so if I could just get you to stand around, I'll just show you how we're going to do this. So we've checked for danger, make sure everything is safe. We need a response, so we're going, let's call him Andrew, shall we? For want of a better name. Okay. Hello, can you hear me? Hello, can you hear me? Hello, and we're going to do a trap squeeze. Oh, can everyone see?
Yeah.
Yep. Okay, hello, can you hear me? No response. Okay, so what we're going to do now is we're visually going to, I haven't got a face on, but I'm going to visually check in his airway to see if there's anything stuck in there. And I can't see anything in there. Okay, so now we're going to start breathing for him. So we're going to go from the armpits across to the middle of the chest. It used to be across the nipple line, but the thing is nipples move as we age.
Everybody gets
Gravity
that.
happens, that's right.
Everybody gets that joke.
Yes, so one hand on the chest, interlock the fingers, and we are going to pump. Ready? Rolling from the hips. We've locked our arms in and we're rolling from the hips. 1/3 of the way down. You can hear that I've hit the mark by the way it's crunching. And like Vinny said, if you break a rib, doesn't matter. Better off to get them breathing.
Do most people's ribs break?
No,
No.
no, it's not as a general rule, no. Okay.
If you've got a 95-year-old lady
Yeah.
whose bones are brittle, they probably will.
Yeah.
What about a child?
No, well, you're using 2 fingers on a
true.
baby and
Child.
one hand on a child.
I mean, you
So, yeah.
can hyperextend a chest and a child as well and crack a rib.
Yeah.
And that's when you do start to crack ribs. Children, as you guys would know, is very resilient and they bounce back. But if you go too far and hyperextend or crack, I've never done it. By the way, I've done CPR, but I've never cracked a rib. So,
Yeah.
but they say if you're cracking a rib, you're probably not in the right location. You're starting to roll the cage instead of pushing down on it.
Yeah.
Okay, and then they start to. But as I said, you got a 95-year-old lady or a man where their bones are very brittle and dried out. Then they start to crack. It's not a big drama, of course. They've got enough to worry about than having a couple of cracked ribs.
So the one thing that I should have done that I missed, but I'll come back to it,
Yes,
is
you did.
I should have look, listen, feel. So hand on the chest, listening for air. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Does anybody know why we wait 10 seconds? What's the 10-second rule? No?
Start breathing?
That's right, yeah. Because if they've got a brain injury, 10 seconds is long enough for them to actually maybe have a breath if they are breathing for themselves. 10 seconds is long enough. Okay, so we've done our 30 compressions. We've done 2 rescue breaths. Straight back on the compressions again. We get someone to go and get the AED. So we're going to get this open. And like I said, it's all self-explanatory. We've got the pads here. We've got the machine here. Big green button turns it on. Okay. There we go. Plug that in.
Press pads firmly to patient's bare chest.
And it tells you where to put them. Alright. Nice and sticky.
Analyzing heart
Oh,
rhythm.
hang on. Okay, alright.
Analyzing heart rhythm. Do not touch the patient.
Don't touch, everybody away. This is where I said we don't want anyone touching the patient.
Shock advised.
Okay, so it's going to tell me shock advice. It's going to whir up. When you say charging, you will hear
Stay
it whir
clear
up.
of the patient.
Everybody stand clear.
Deliver shock now.
And
Press the
shocking
orange button.
now, so
Now.
everybody knows that you are giving that shock. You press the
Shock
button.
delivered.
That's it. That's all there is to it.
Start
Back onto
CPR.
CPR. and you've got a metronome that tells you,
Oh, gee, that's good.
yeah, they all have
And
it.
it's always 30.
Yep, 30 and 2 breaths. If you're not going to do the breaths, you
Take a
don't
break.
stop.
Oh, you don't stop.
You do not stop. You keep going. If there are 2 of you, you can go, okay, 27, 28, 29, 30, and then have your partner take over.
Gotcha.
So you can have a break. Yeah, okay,
So at 2 minutes.
yep. So that goes in 2-minute cycles. Okay,
Analyzing heart rhythm.
hang on, keep going.
Do not touch the patient.
Hands off. Everybody stand
No
clear.
shock advised.
No shock advised. So
Start CPR.
just keep going. Okay. All right, let's say that our little friend, he's having a cough, a splutter, his eyes are flickering. Okay, he's starting to breathe. We keep the pads on, we don't turn the machine off, because every 2 minutes it will go through the cycle again and check to see what's happening. We'll now put him in the stable side position. We can support his back with our legs.
Or known as the recovery position.
Recovery
You guys.
position, yeah. Yeah, and we just monitor him like this, okay, because that could once again stop breathing. If that happens, bring them back onto their back, sorry dude, and back on CPR once more, okay? If you find you can't do the interlocking fingers, you can do CPR like this, or same, on the other side. Okay?
If they stop breathing and got into the recovery position, we roll them back. What do we need to do first?
Something about the, roll the head back again.
We need to recheck the airway and their breathing, don't
Oh,
we?
that's it.
Okay, so let's, yep, that's good.
Okay,
Okay.
so any questions?
Yeah, Michelle, when do you do the head, pushing the chin back?
The head tilt, you do that at airway. So as you're
Only at
checking
the
the,
very beginning?
at the very beginning,
And if you're going to
and
do
if
2
you're
rescue
doing
breaths as well.
And if you're gonna do rescue breaths.
Okay.
Sorry.
What about if
Yeah.
you roll them back and roll them back again? You assume that the head's gonna keep,
Well, you have a look to find out if there was something that gravity may have brought up,
Yeah.
and this is why they stopped breathing
Yeah,
again.
I know
So
what you're
we
asking.
check the
Yeah,
airway.
I just
Sorry,
wanted-
no, if you roll them back again, you'll
Yeah.
have to reset.
you
that.
reset the head?
Yep.
Yeah.
Okay.
Because they'll be all floppy and
Yeah, of
floppy.
course they will,
Yeah.
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 I mean, it'll be obvious when you're doing it.
So, it's entirely up to you if you wanna do your rescue breaths or not. Okay. Everybody ready to have a go?
The assessment today is fine. You can
Yep.
either do it or you don't have to. It's
Yep.
absolutely entirely up to you.
Yeah. Okay,
You'll
right,
pass
so I'm
either
gonna pack
way.
this one away. So what we'll do, we'll work in pairs.
Rescue breaths are what we're breathing today, aren't they?
And,
Okay, we've done little faces.
yep. Alright.
Face. Oh, sorry.
Got faces, yeah.
Now, so we're gonna give you a little bit of a scenario. Andrew we'll go with Mary this time. Mary was crossing the road. She's got her bags of shopping. She's got to cross the road safely. She's on the pavement on the other side. All of a sudden, she has dropped her shopping and she's clutching at her chest and has collapsed. What are you gonna do? Danger, yes.
Yeah.
Danger, okay. Danger.
Danger.
He's away
Check.
from the road.
Okay, so we're going to do and see now. So as we do, you're now going to do those
Okay.
actions.
Yep.
Shell's going to talk you through it firstly,
Yep.
and you're going to do those actions.
Would you wanna go
Okay,
first?
we ready? Right, let's go. Danger?
Danger.
This is danger.
She's okay. Well,
Danger?
Yep.
Yep.
Yep, that's it.
Response.
Response. Are you getting any response?
Take control.
No response? Okay, put his face on. Hang on.
Remember what happens between response and airway. Something's got to happen between
Let's
that.
do one more thing.
You got to call for help.
Absolutely.
Yes, send for help.
It's okay, you've got to say to me.
Would you call the ambulance?
Okay,
Triple
okay.
line. Triple line.
Check with the airway.
Beautiful, well done.
Ambulance is on its way.
Check the airway. Okay, pop your face on if you wish.
It's not breathing.
Okay,
Start
Right.
compression.
okay, start your compressions.
Should we have compressions now?
What's straight?
Just straight on the compressions.
So the AEDs haven't arrived yet,
They
okay?
haven't arrived yet, we're just gonna get on the CPR. So, yep, push down, lock your arms in and roll from the hips.
Rock and roll.
Come closer to
Come closer to the patient, so
Let me
have
get
your
my
knees
face up.
right up.
I'll get my face in there.
Nicely done, beautiful, yep, good. Yep. Very good. Okay. All right, okay, so, how you
1/3.
going? Yep, a little bit deeper, lock your arms
Deeper.
in.
That's it.
Lock your arms in, yep, and roll from the hips, that's it. Lock the arms in. Oh, no, you only do that in the initial phase at the start, and then you, so CPR
you counting
30, 30 compressions, right,
And then keep going.
for 5 cycles, and that'll be your 2 minutes, okay?
Not really.
Right. Keep going.
AEDs have arrived. So let's
Okay, your
get
AEDs have turned up,
assistant if you can get these AEDs on.
other person. Keep going, you've gotta keep doing
You're not
CPR,
stuck.
or he's gonna die, come on.
Okay, there's 5 times we stop CPR. 1 if the patient recovers, in which case you get your name in the news and you're a hero.
Keep going, keep
The other one is if you can't physically continue. On top,
I'll put that one.
on the face. Right. That's it, got it? Yeah, there you go. Hang on, let's get these pads on. Have a look at the pictures, look at the pads. That's a trial pad.
Oh, yep, there you go.
Oh, yep, take that one there, that's fine. All good, doing well.
Keep going.
Hey, listen to your machine, okay? Listen to your machine.
Okay, I'll work, no, keep doing CPR and we'll work around. That one's gonna go on the other side there, right, go, keep pumping.
Doing well.
Listen,
That's okay, don't listen to the machines.
clear as the patient, do not touch.
Listen to your machine.
Okay, CPR, straight back on.
In here. Turn around, that's it.
That's it.
Stay clear of deliver shock now. Shock bedrest is on now.
Gotta wait for, I know, it feels like forever, doesn't it, but,
CPR.
yep.
Deliver shock CPR.
Put yours in, put yours on, good.
Delivered. Analyzing
Back on CPR.
analyzing heart PR.
You can change over now if you want.
A little bit deeper, okay?
Not touch.
Well, once you get the metronome on, it's just the metronome.
Shock advised. Charging.
Yep.
Charge shock advised. Stay clear
Okay,
of
so
patient.
shock advice, so hands off.
Deliver shock now.
What's the orange button on?
Okay, so you guys.
Seems a bit confusing, now, but it will sink in.
CPR and you can
Well, this is
do
yours,
that.
I'll be next.
Okay, how are we going?
So
Are we
right-
gonna, have we swapped over yet?
No.
Oh, you need to swap
Are you
over,
happy?
yep.
Oh.
Swap over.
Good.
Are you happy?
So do we start from scratch again with the defibrillator and everything?
Yeah.
Okay.
So instead of stabbing, just nice and gentle yourself from the
Danger.
hips.
Analyzing heart
There's nobody around.
Listen to your machine, the machine now wants
Not
it.
to touch the patient.
Hi, are you okay?
Right.
Are you okay?
Here's my chocolate with you.
No? Oh, I don't hear anything. Okay,
You
you're
are
not
not doing
okay.
it.
All right, take it.
Stay clear of the patient. Stay clear of the patient. Heart rate. Deliver shock
Okay.
now.
Change that number.
It's all right.
Make sure you change that number. That number change.
Now that.
Shock analyzing heart rhythm. CPR.
You're a bit too low, so come to the mid.
Oh, okay.
Right there.
Okay.
There you go. Lock in the arms. Lock the arms in. That's it. Beautiful.
Yeah.
rolling from the hips. How you going there, Dave? Okay, keep going, doing well, guys. Doing really good. Okay, now our little friend's having a cough and a splutter. What are we going to do?
You're gonna come up behind him and what do we get him to tell us?
Okay.
Did you put him in recovery?
Yep, stable side position, recovery position coming up.
Pull them away from you, that's it.
So turn him on his side, and you always,
That's
we always turn the person away from us, okay? We're on our own,
Vomit on us.
yeah, in case they decide to vomit. I mean, because all you've got is a closure wound.
Yeah.
And that's one of the reasons why you should, never give your clothing or anything away to the patient. If you've got to stop bleeding, you use their clothing. Because otherwise you're going to be left standing in the street with no shirt on,
Yeah.
okay?
And you can go into shock as well.
Well, that's exactly right,
Absolutely.
yeah.
And that
Yeah,
makes you
that's
cold.
right. Okay. Oh, you stop? No, we don't take anything off because the machine will reanalyze that heart rhythm again. Okay, so please stop breathing again. What are we going to do?
No.
Back
We're
into
gonna
the-
check. Stop breathing. Okay.
Airway.
Yeah.
Do the two.
Good job, guys. Good job. Well
And
done.
we're gonna go through that airway breathing again.
Analyzing
Yep.
heart rhythm.
Airway breathing. Yep. So look, listen, feel. Yep. Look, listen,
No
feel.
shock advised.
Okay.
Well done.
Start CPR.
Oh. Did you turn your machine off?
Yeah.
No, you don't ever turn the machine off. You
Analyzing
leave it
heart
on
rhythm.
so it can keep,
Do not touch the patient. Analyzing heart rhythm. Analyzing shock patient. Do not start a shock. Do not touch. Analyzing heart rhythm. Analyzing heart rhythm. CPR. Do not touch the patient. Do not touch the patient.
childcare workers.
Charging. Shock advised. Shock
Okay.
advised. The patient. Charging.
Childcare workers, I'll just give you one of those. You can have
Stay
a
clear of the patient. Stay clear of the patient. Deliver shock now. Deliver shock now.
Very good.
I
Well
haven't heard
done.
anyone say shocking, shocking, shocking now. So
Good,
everybody
nice.
know that you're gonna
Nice
shock.
dip, 1/3, perfect.
Yeah, perfect,
Yeah, very
doing
good.
really good. You're gonna be
Yeah,
on
good,
tomorrow's
nice dip,
paper.
1/3. I know we're starting to
Save
get
for
tired.
life. Whoop, whoop. Yeah, fabulous. Okay. All right. Now he is coughing again.
Oh,
Okay. And the ambos have arrived.
Oh, yeah.
Yeah.
Thank
Okay.
goodness you're here.
So what we do when we hand over to the
Hand
ambos,
over,
alright, you can turn your machines off, guys. Oh, that's better, isn't it? Nice and
Oh.
silent.
And they're all
Okay.
breathing.
Yeah, they're all breathing, they're all alive. Well done. Good job. So when the ambos come, we want to
Hand over.
do a brief handover. So we tell them that we found our Mary collapsed in the street. We've done CPR for a full 5 minutes or whatever. So we've done 2.5 cycles of 30 of 5 lots of 30 compressions and 2 rescue breaths. Okay. So, and then we just go from there. He's been shocked 3 times by the defibrillator, and the ambos know everything that's happened.
Perfect.
So that was really good. Now, for you guys that were doing your certificate, that was your assessment, and you have all passed. So there you go. So there's no need to get all worried and scared, or because you've done it and you did so well. So thank you very much for that. Okay, I'll ask you to pack up the dummies for me. Any questions? Anybody got any questions?
If there are no defibrillators,
You just do CPR.
Yeah.
Just
And
continually do CPR.
Because-
There's yeah, you've got the. Where's your just some plastic that goes on.
Oh, in
Those?
between them?
Yeah.
Yeah, there's a clear piece of plastic.
Yeah.
Oh,
And it goes invisible when it's on the carpet. There it
It
is.
does. Yeah. Sometimes it's really hard to find.
oh,
Yeah.
I see, but even
Yeah.
though you took these.
Alright. Alrighty. So, any Yep,
Well.
you did well. Any other questions, guys? Did you guys have a practice with the babies?
Yes.
Yes? So what do we do with the pads on babies? Do you remember? Yep, one on the front, one on the back. Okay, yep.
Ciao.
Otherwise, everything else is exactly the same. Huh?
Finish.
Okay.
You're at 40 minutes.
Oh, okay. Wow, that went really quickly, didn't it? So, we have, learned how to do CPR successfully. You guys have done really well. For those of you that you've passed your practical today, if you've done your, online component, you'll get your certificate this afternoon.
Yeah.
If you haven't completed the whole online component, do that today, and then you'll get issued your certificate tomorrow, okay? Awesome. Thank you. You're welcome. Thank you so much.
So who's doing the? Oh, sorry.
Okay.
There you go.